Hi, my name is Jessica Crimaldi. I'm a nurse practitioner at the Cleveland Clinic, and I've been working in inpatient GI and hepatology for almost 10 years. Today on this podcast, I'm just going to address two common questions that we get from primary care providers related to patients with MASH or MASLD. So the first one is, what do we do about statins? So most primary care providers have it ingrained that statins can cause LFT elevations, and they may potentially be discontinuing them or thinking about discontinuing them in a patient with MASLD or MAS because of their elevations or because they have elevations to start with, maybe not wanting to start them. So this is a really great question. We know that one of the treatments we can provide for patients with MASLD and MASH is treating their cardiometabolic risk factors. So that's helping to control their cholesterol, keep their diabetes tightly controlled, work on weight loss, all of those things. So statins are actually an important part of that puzzle. For MASLD and MASH specifically, they do help to slow liver disease progression, and they can safely be considered as an ongoing treatment. They can be continued also in compensated cirrhosis, and they may decrease the risk of an esophageal variceal bleed, which is wonderful. They are contraindicated in decompensated cirrhosis and in acute liver failure. I will say, if you ever have a concern about how your patient's numbers are looking either on a statin or if you're thinking about starting a statin, but they already have baseline LFT elevations, don't hesitate to have a liver specialist review the patient, but we really should be thinking about keeping patients on statins or starting statins when indicated, unless, again, they are decompensated cirrhosis or in acute liver failure. But never hesitate to reach out to discuss a patient's individual case. The second question is, what workup can be done while the patient is waiting to get to a liver specialist or before we refer them to a liver specialist? So for MASLD or MASH, that's a great question. And I think we should always obtain some baseline labs. Specifically, you want to have a CBC, which would include a platelet count, and either a CMP or hepatic function panel, which will give you your liver biochemistries. Having both of those available, as well as the patient's age, allows you to calculate a FIB4, which can give you really quickly an indication of whether there's a low, indeterminate, or high risk of advanced scarring or fibrosis simply by plugging a few numbers into a calculator. And there's many FIB4 free calculators available online. And so that would be very helpful. You can also consider checking an INR, which can be helpful in determining liver function. And if it's elevated outside of someone who's on Coumadin or may have a malnutrition vitamin K related deficiency, that can give us some indication as to how the liver is doing. As a second step, you would want to consider if you have a high concern or high pretest probability for advanced liver disease or MASH or MASLD, you'd want to consider ruling out other causes of liver disease. So that would involve screening for viral hepatitis, such as hepatitis B and C, autoimmune liver disorders, such as autoimmune hepatitis. You want to look for genetic conditions, such as alpha-1 antitrypsin deficiency, hemochromatosis, etc. So there's a whole panel of labs you can do for that, but we wouldn't expect you to know or do all of them. But you do want to think about maybe some of the more common ones, such as viral hepatitis, especially if your patient is in that baby boomer population or potentially has a risk of a household or common exposure or intranasal drug use. So any of the chronic liver disease serologies that you can send ahead of time are helpful, but definitely just getting that basic CBC and CMP or hepatic function panel and maybe an INR ahead of time so that we can calculate some of our pretty simple scores is very helpful. Thank you so much for joining with these few questions, and we look forward to continuing to provide education through this network. And if you have any questions, please don't hesitate to reach out. Thank you.